Minister of Health, Professor Onyebuchi Chukwu. Well, indeed, improving Nigeria's health sector requires a collaborative effort. Participants at the ongoing meeting of the Association of Nigerian Physicians in the Americas agree that government must, however, create an enabling environment for medical investment. Our correspondent, Yomi Otaigbe, who's covering the meeting in Southern California, United States of America, reports.
In developed countries such as the United States of America, healthcare systems are well laid out with health services made available by both the government and the private sector. But in Nigeria, there's a huge gap when it comes to public-private investment in healthcare.
Other healthcare providers.
Filling up this gap is what this panel of discussants seeks to address. Members of the Association of Nigerian Physicians in the Americas formed the audience. Taking turns, the panelists, made up of Nigerian government official, legal and medical practitioners, as well as investment advisor, looked at the challenges and the changes that will positively turn things around.
Medical tourism. We have $1 billion getting out of the country every year in cost of care that is being sought abroad. And that means there's demand that is not satisfied locally and it goes out.
You know that it's a legal and regulatory framework that attracts investments. If there is any revolution in the telecoms industry today, in power today, it actually rests in the enabling law, which is why, at least for healthcare, this is a good start. And what's going to happen is that anybody who wants to come and invest will ask the critical questions. How do I take my money in? How safe is it? And how do I get it out?
Naira terms, 4.1 trillion Naira investment, not only by the public sector, but by private sector and public sector, was required to get to where we're to be. But certainly if we're going to get the private sector to be much interested, financing must be predictable, it must be sustainable, and the administration must be easy. So there's ongoing work at different levels.
If you can pull 1,500 to do $10,000 alone, ANPA fund by next year when we come here, we'll possibly have $15 million. Now, if we do that, if we can do that, and we create a business case and a lobbying force, we can then go to Honorable Minister, sir, and say we have put our money where our mouth is.
Members of the audience do have their concerns, but overall, they seem to agree that there are opportunities to be harnessed in Nigeria's health sector.
As large and centralized as this federal government is, its impact at the local level is more limited. So I think working with a state government or even an NGO or a smaller local government might be an easier way to get into that space.
Many here believe that to solve most of the economic, social and healthcare challenges in Nigeria, government needs to apply the necessary political will to drive through the entire power sector reform process. From the 2014 annual meeting of the Association of Nigerian Physicians in the Americas, holding in Anaheim, California, Yomi Otaigbe reporting for Channels Television News.
Well, in part two, after the break, we're still going to be talking health. The medical experts say everyone is bound to experience cataract at some point in their life, but there's something you can do that may delay its occurrence. We'll let you know what that is in a moment. Please stay with us.